And now on our Health Watch, where we discuss all the topics that are trending in the medical world. So we're sending things over to Keith McGilvery with Dr. Syed Hussain in Studio 61 for much more.
Dr. Hussain definitely on call. Thank you, Erica. As always, joined by Dr. Hussain, Trinity Health of New England, to your point. And doctor, so much to get to, so I want to jump right into it.
Sure.
Depression and teenage boys, a new study suggesting that oftentimes it goes undetected, that warning signs in boys may be different than girls. Let's talk directly to a mom or dad at home. What should we know?
Sure, absolutely. Good question, Keith. So what parents should keep in mind is that boys, adolescent boys may exhibit behavior that is very different from the typical what we associate with depression. So not eating well, not sleeping well, being sad, being quiet, being withdrawn. Those signs may not always be pronounced in young boys and adolescents. So what we should look for, are they more irritable? Is there more aggressive behavior? Are they arguing more? Those things. Or you may frequently hear parents say, oh, I'm walking on eggshells around my boy because I don't know what's going to trigger them. So all of these are signs where, we need to have a more open discussion, give avenues for boys to be able to voice concerns, listen to them. And then always, like I say on these segments, access is important to healthcare. There was a study that was recently done that indicated that antidepressant prescriptions during the course of the pandemic for women and for girls actually went up, which we expected because of all the effects related to the lockdowns. But for boys, it actually went down.
And if I had symphony skills, I'd be able to sing this. But as we go from boys to men, I want to talk about stress here. A study, Journal Gerontology, pointing out that stress in men can often lead to earlier death. I don't know that I'm necessarily shocked by that. But how do we tackle that now? What do we do?
So there's an association in this study that you're referring to that basically shows that the effort expended by men in terms of coping strategies with stress at a later stage in life may be linked to earlier death. So again, it goes back to the whole premise of, are we putting enough resources in place for men, women, everyone, for children, for boys, girls, to be able to deal with mental health issues, with stress, and do they have access to the right type of care at the right time?
This one, a controversial one, we were talking about it a little bit during the commercial break, fasting. The American Heart Association talking about research that it says folks who will fast for an 8-hour period run the risk of cardiovascular death at higher rates than maybe some others. Some people swear by fasting. Other people say no way. What is your take on fasting?
Yeah, this is one study. There's been a lot of literature out there that, on benefits of intermittent fasting. This study actually shows long-term effects may not be that beneficial, and maybe actually there may be an association, so I want to be careful what I say here, with cardiovascular death. So more research is needed into the mechanisms related to that, but it's suffice to say that you need to have a conversation with your primary care doctor before embarking on anything that will lead to lifestyle modification.
COVID-19 vaccines, I'm only glancing at my notes here because I want to get the details right, but found a new study reducing the risk of heart failure and blood clots after infection. The British Medical Journal claiming the risk is cut by up to 55% and blood clots by 78%. Talk about the correlation here between the vaccine and long-term health issues.
Sure,
COVID.
and this is more that we're finding out about the benefits of the vaccine. So what we do know, based on current data, is the vaccines confer a lower risk, actually a higher benefit in terms of preventing complications, preventing severe complications from COVID-19. So this goes in the same vein that thromboembolic, which means clots, or cardiac conditions, heart conditions, complications from COVID-19 infection in patients who've been vaccinated are lower, which again, it goes well with the data that we currently know on reduction in risk of severe disease in patients who are vaccinated.
Dr. Hussain, always with that unique ability to make the complex digestible. Grateful to have you on the couch, and we'll see you next week.
Thank you, absolutely.
All right, Erica, some really important information, especially about our teenagers and their mental health.